Welcome to the Center for Special Minimally Invasive and Robotic Surgery with Dr. Camran Nezhat. Today, we will review your surgical plan, sign your consent forms, review your surgery preparation, answer insurance questions, and address any additional concerns that you may have. At today's visit, you will receive your prescriptions for the medications to take before and after your surgery. We strongly recommend that you fill them about 3 days before your surgery, as you may leave the surgery center later in the day and some medications might require prior authorization from your insurance. The day before your procedure, you will receive a phone call from the surgery center's pre-op team to confirm your check-in and surgery time. Please remove all jewelry, including nose, belly button, and wedding rings for surgery. Leave your valuables at home and do not wear makeup, nail polish, or lotion the day of surgery.
Before your surgery, please do not take any kind of blood thinners like Motrin, naproxen, aspirin. Don't take any of them for a couple of weeks, please. Or if you do take them or have taken them, please let us know. Do not use too much vitamin in excess. 1 vitamin a day is quite adequate. Stop taking all of these herbal medications a couple of weeks in advance. The reason is that it thins your blood and it may interfere with the anesthesia. Do not use any marijuana or its product, and if you have used it, please tell us. It is important. Before your surgery, it is important that every day you be active. You do some breathing exercises for 3 to 4 minutes every day. Breathe very deeply and let it go. Then your lungs get stronger and they can tolerate the anesthesia much better. Again, before your surgery, please make sure you stay active and walk every day for 4 or 5 minutes at least. If you are a vegan or vegetarian, please make sure you let us know. 2 or 3 days before your surgery, have a good diet of carbohydrate because that would help you recover faster. So you heard me correctly. 3 to 4 days before, have a good diet of carbohydrate. The day before surgery, also have a carbohydrate diet, but not heavy, very, very mild. Please do not eat after 7 or 8 p.m. the latest. Drink fluids. Again, carbohydrate fluid would be fine. After midnight, please do not drink anything. Your surgery is in the morning, so please do not have any fluids after midnight. If in the morning you wake up and you have to take your Pre-Operative to make your urine orange for surgery, you can take it with a little sip of water. That is okay. Otherwise, don't drink anything. You can brush your teeth and that is fine.
Avoid red and blue foods and food coloring. Examples of things you may drink include apple juice, white grape juice, Gatorade, 7-Up, and Sprite. Please also avoid dairy products.
Important is that you put your Cytotec the night before, and in the morning when you get up, take 2 of the Pre-Operative with a little sip of water.
Cytotec is a prostaglandin that softens the cervix before surgery. The night before surgery, place the medication in the vagina before bed. It may cause cramping and vaginal bleeding. If you need to take pain medication, do not take anti-inflammatory medication such as ibuprofen or naproxen. In other words, no Motrin, Advil, or Aleve. You may take over-the-counter Tylenol for pain. Pyridium will turn your urine orange. It makes it easier to evaluate your ureters at the time of cystoscopy. It is a urinary pain reliever and treats pain, burning, increased urination, and increased urge to urinate. If you find that you're having these symptoms, Take 1 tablet by mouth twice a day or as needed post-operatively. You can also purchase over-the-counter brands to alleviate these symptoms. Take this medication 2 to 3 hours before your surgery time, not the time that you need to check in for surgery.
We do not do routine bowel prep unless we tell you. And you may want, if possible, use 1 or 2 enemas around 7 to 8 p.m. because it just empties your bowel and makes the surgery a little bit easier.
Your post-operative appointment will be 4 to 6 weeks after your surgery with subsequent visits 6, 8, and 12 months post-op. There may be various medication you will need to take post-operatively. The physician will discuss these with you in detail, and more information can be found in your pre-operative packet.
After your surgery, in the recovery room, you wake up immediately and they will get you to empty your bladder and walk 3 to 4 minutes. So the day of surgery, we encourage you to walk 3 to 5 minutes every hour and empty your bladder as often as you can.
Please continue your deep breathing after your surgery using the incentive spirometer you will receive from the surgery center. Do this several times every hour to keep your lungs open. Most patients will have their first bowel movement within 3 to 7 days following surgery. Do not be alarmed if your bowel movements are not regular for the first week. It is normal to experience light bleeding after surgery. If you're concerned about the amount of bleeding, you may use the following guideline to help you. Am I needing to change my pad every hour? Is the pad saturated when I change it? If you're using a maxi pad and the answer is yes, you should contact the office. If the answer is no, the bleeding is normal and will eventually subside. If you are unsure, do not hesitate to call us. Your first 3 periods following surgery may be irregular in timing, duration, or amount of bleeding. If you feel that you need medication for the pain and Tylenol and ibuprofen are not helpful, please contact the office. If you have undergone a hysterectomy and bleeding is persistent for over 2 weeks and/or is increasing in flow rather than slowing down, please contact us to review your symptoms. Do not use tampons for the first 2 to 3 weeks after surgery. The goal is to gradually return to a normal diet. Please start with liquids. A liquid diet consists of any food that is liquid in its original form. This includes broths, smoothies, and jello. Once you pass gas from your bottom, you can start a soft foods diet. Some examples of soft foods include applesauce, mashed potatoes, and rice. If you tolerate this diet for 2 to 3 days and have a bowel movement, you may begin a normal diet. If you are not passing gas from your bottom, you must remain on a liquid diet until you do so. Do not overuse the abdominal muscles for 2 weeks. This means no lifting and straining. However, we do want you to be up and moving around. Being a couch potato will only prolong your recovery. We recommend you walk 5 to 10 minutes every hour. Patients should be able to return to light exercise and sexual activity 2 to 4 weeks after surgery. However, these guidelines can change dependent on your surgery, and return to these activities should be discussed with the physician. For hysterectomy patients, exercise and sexual activity should not be resumed for at least 6 weeks postoperatively. Do not place anything in the vagina until the doctor tells you it is safe to do so. Please remove all dressings except steri strips 24 hours after surgery. Make sure to keep all incisions clean and dry. If you have steri strips over each incision, they will start peeling away in approximately 7 to 10 days. If the strips begin to come off sooner, that's fine. We suggest removing them in the shower when they're wet. They'll easily peel away from the skin without pulling the incision. The steri strips must come off by day 10. Because the umbilicus is like a cup and retains water and moisture after you shower, that incision site is slightly more prone to infection for the first few days. We ask that you use a blow dryer for the first 7 to 10 days to dry the area. Do not apply liquid or ointment medications or any other product to protect the wound while your incisions are healing. You can wrap gauze around your finger to clean your belly button daily. Do not use Q-tips for cleaning during this period. Swelling, redness, and pain are common with all wounds and will go away as the wound heals. If swelling, redness, or pain increases, if the pain feels warm to the touch, or your wound edges reopen or separate, please call the office. You may shower as often as you'd like after surgery. However, please refrain from sitting in a bathtub, hot tub, or swimming for the first 3 weeks so that you can allow your incisions to heal. Be sure to dry your incisions after water exposure. Do not feel rushed to return to work. Recovery is an important process, and return to work or activities too soon can extend your recovery. Please contact our office regarding disability paperwork. More information can be found in the last page of your pre-operative packet. Please refrain from driving for a minimum of 7 days. Never drive while taking pain medication, and please use good judgment before driving. Our physicians and staff are always available, even after hours. No question or concern is too small. During normal business hours, you may contact the office at 650-327-8778. During after hours and the weekends, you may call 650-723-6661. The pager ID is 14239. Please notify us if you develop a temperature of 100.4 degrees or greater. Using the guidelines for bleeding, you're experiencing heavy vaginal bleeding, undue pain that is not manageable by your pain medications, or severe nausea and vomiting. Please note that it is normal to have some clear to slightly bloody discharge during healing. Signs of infection include thick, yellowish-greenish discharge, inflammation at the site, warm to touch, and a fever. You should be feeling a little better every day. If you feel like you are getting worse than the day before, please contact the physician on call. We wish you a speedy recovery. Our office is dedicated to the health and recovery of each and every patient. Do not hesitate to call us at any time if you have any questions or concerns.